Dr. Brink, welcome to Bahrain. Thank you very much for talking to Kalam Saha. How's Bahrain? How's the conference so far?
It's very good, well attended, lots of questions. It's very good.
A lot of audience here. I think around 500.
Yes.
How's the feedback so far?
It's been very good. Thank you very much.
We listened to your speech yesterday and today. And yesterday you were talking about hospital-acquired infections. What does it mean for patients? Do they have to be scared now to go to a hospital, or what is your advice for the patients?
They don't have to be scared to go to the hospital because the principles we discussed prevent the transmission of infection in the hospitals. So there's no problem going as long as people wash their hands and do the principles that we discussed.
Okay, and what are, if you put it in three short terms, what is your main recommendation for doctors in the hospitals to tackle the problem?
Well, they have to follow infection control procedures. They have to follow the clinical pharmacist antibiotic conservation procedures,
okay.
And they need to inform the patients at the same time so
okay.
that they get educated regarding these principles.
I heard in your speech today that education of patients might be quite effective. What can you suggest to patients to take own responsibility to probably be more careful in the use of antibiotics?
Well, I don't think patients understand the consequences of taking antibiotics when they shouldn't, because they put themselves at danger by taking an antibiotic for a viral infection, by causing possible risks of having a resilient bacteria which can cause infection which the doctor can't treat.
To make it very clear to patients, can a patient feel or smell or understand by himself if he has a bacterial infection or a viral infection?
No.
Not at all.
Both of them cause fever. There's no distinction.
So
So you have to trust the doctor if he says you don't need an infection or you do need one.
So and to make it also very clear, antibiotics are only for
bacterial
infections, not for viral infections. No. So you mentioned also that the pharmacists will have a very high responsibility or should have more of a responsibility. In the past here in Bahrain, antibiotics were over-the-counter medication. Luckily this changed. What do you expect from pharmacists in the future?
Well, Bahrain became one of the first countries to ban the over-the-counter use of antibiotics in this area, for a very good reason, because the continued use of these antibiotics over-the-counter in the long run has a very bad effect on the future of the children of this country.
Yeah.
So banning these antibiotics is part of the world interventions like any other country to stop the abuse because of the threat to the children in the future.
Traveling is obviously an issue that is distributing infections and diseases here in the region, especially the Hajj time, where millions and millions of pilgrims are on the travel, is a time that is quite difficult. What would you suggest people who plan to travel, who want to go to Hajj? What is your advice for them?
No, it's a complicated question, but basically normal hygiene precautions apply, of washing your hands when you cough, before you go to the bathroom, when you come back from the bathroom, These are simple hand procedures to decontaminate your hands mostly.
Cover the mouth
When you cough.
if you cough.
Yeah.
And
Yeah.
okay.